Now, in the race to vaccinate, we heard a lot this week about whether a third COVID vaccine dose will or won't be necessary anytime soon. So we know you have a lot of questions. So it's a good thing that we have our friend and medical expert here to join us and to answer your questions. Here's Dr. Arnold Baskies, who's the past chairman and also chair of the Global Cancer Control Advisory Council. Dr. B, good morning.
Good morning, Stephania. How are you?
Good, good. So this is about Pfizer, right? It says that it's seeing waning immunity from its shot. So now the company wants authorization for a third dose. But the FDA and CDC says that fully vaccinated people don't need that booster shot yet. So help us make sense of this. What's going on here? And Pfizer or the feds? Who should we be listening to?
So you're absolutely correct, Stephania. There is a dichotomy here between the federal government and what Pfizer has said. So is it confusing? Yes, it is. But let's try to put some context to this. What led Pfizer to make this announcement is what was done in Israel over the last month or two, where they've been monitoring the effects of the Delta virus. Basically, the vaccine, the Pfizer vaccine, efficacy dropped from about 90% to about 64%. But the important part of this whole story is that although it wasn't as protective against getting the virus, it was very effective in terms of keeping people out of the hospital. So the bottom line is this: based on what we know at this time, I do believe that a booster shot, based on what we know already, will be recommended probably by the fall for certain segments of our society, those people who are most vulnerable. But at the end of we need to get our entire population vaccinated, because we know that this particular set of vaccines, these messenger RNA vaccines, are extremely effective in keeping you from getting in the hospital. So get vaccinated. That's the basic message. Will a booster be needed? Probably for at least some segment of our population.
Yeah, I'm just kind of thinking the same way that you get a yearly flu shot. Maybe it'll kind of work like that. Now, Pfizer also said that it's planning to tailor the third dose to fight this Delta variant that's now dominant in the U.S. You yourself have been very concerned about this one because it's more contagious, a lot more dangerous. But that's Pfizer. What if you got Moderna or the J&J vaccine?
So
how does that work as far as boosters are concerned?
Right. So the basic question that you're asking is mixing and matching a good thing? And the answer is yes, it is. Based on what we know from some small studies, we know that you get a better bang for the buck, if you will, by mixing the vaccines than by taking the same vaccines over and over again. And this is not the first time that vaccines have been mixed. We know back as long ago as 1948 that bringing two vaccines together is more effective than a single one. So the bottom line for this is very simple. It's too early to know for sure whether mixing vaccines will be approved, but I do believe that combining vaccines will be a very acceptable approach.
You know, so I have to ask you a follow-up question on this. When you talk about Pfizer and the J&J vaccine and Moderna, should we think of these as just sort of different brands?
Well, the J&J vaccine is different in the way it's made than the other two. But yes, think of it as different brands. But I think we will be mixing and matching these vaccines, and I think it will be safe. The problem is that there are only a few small studies that have been done to date to show that it's safe and efficacious. But there's a lot of work going on looking at this question. So by the fall, I think we'll have a much better approach than we have now and a much better set of data to look at. At the end of the day, I think that we will be mixing and matching these vaccines.
Quote him later. Dr. B.
Thanks, Stephanie. Have a great day. And go Phillies.
You too. Yeah, there you go. All right. I've been missing that. Thank you, Dr. B.